Shah, diabetologist from Sikandrabad, practicing since 42 years. I would like to give few small tips to the diabetic patients. In this era of lockdown, how would you control your sugar level, which is very, very important because of no going outside the house, you will be not able to do all the activities which you were doing earlier. Now, number one is the physical activity. I request everybody who has a terrace or a ground in front, please don't go on the road or any nearby garden or in the complex. Don't go down for the walking because the chances of getting corona are high if you are walking in your compound along with all your friends and relatives, and then the chances are high. So better walk on a terrace separately, or if not possible, walk in your house only before every feed, or at least 30 minutes non-stop in the house. Secondly, while you're talking with your friends on cell phone, try to walk and talk. Don't sit and talk. So that will be another physical activity, because to pass the time, we are talking with our friends and relatives. So while that time, please walk and talk. Don't sit and talk. I'm repeating again, please talk while walking. So that is very important. Thirdly, please share, as housemates may not be there, please do some household work which will also include in the physical activity. Now, you can do pranayam, a best yoga, and few yogic exercise for 15 to 20 minutes, which you all will be knowing, especially pranayam, Surya Namaskar, or any other exercises of yoga, please do. Thirdly, do few resistance exercise, like few dumbbells, you have 1 kg or 2 kg, do some 15 to 20 minutes that, or do some movements of all your joints from neck to toe. All the joints, please move, and that another 15 to 20 minutes. So round about 80 to 90 minutes, including walking, a physical activity, will try to see that your sugars are under level. Now, secondly, about the diet. Now, this is the time when you're getting watermelon and mangoes. Please don't feast on watermelon and mangoes. You can have 2 to 3 small pieces of watermelon and 1 or 2 slices of mangoes. Only slice, I said, not 1 or 2 mangoes, because you would like to enjoy when you are in the house. I don't mind you taking 1 or 2 pieces, but not full 2, 3 slices or 4 slices of watermelon and 1 or 2 full mangoes. You can have 1 or 2 slices. So, but include citric fruit, which is very important to improve your immune system. Now, to improve your immune system, you must take some citric fruit like mosambi, santra, oranges, sweet lime, and if you have a amla juice in the house, you can take amla juice. You can take fresh lime juice, that is also good. You can add sugar-free or stevia and little salt. Don't take with sugar. Now, you tend to eat more, so to prevent more eating, I request everybody to take few seeds like pumpkin seeds, flax seeds, then you can take sunflower seeds. Now, these seeds will try to reduce your hunger, and they are very high in magnesium, zinc, and other trace elements which we require. We are not used to eat these seeds, so I request everybody to take pumpkin seeds, flax seeds, and other seeds. Now, one more thing is, if you take 4 or 5 badam, 4 or 5 pista, and 4 or 2 walnut, that is 4 or 5 almonds, 4 or 5 pistachio, yeah, but pista, and akhrot, yeah, walnut, 2 pieces. These are immune boosting, and it is a real one multivitamin tablet. So this dry fruit will also help you to improve your immune system. And in your house, when you are there, you like to snack. So please don't snack on other things. Snack on these nuts, snack on the seeds, which I said, and snack on some fruits. Please don't snack on sandwiches or some aloo toast, yes, some other deep fried items. Occasionally you take, there is no problem. Other things which you can snack on are peanuts and sev murmura or few other chudwa, but it should be in a small quantity. Don't. Now, whenever you're taking your tablets, please don't try to miss any of your tablets and insulin dosage. All the tablets and dosage has to be taken. Now, in every year, the laboratories are there, and if you have a glucometer in the house, you can check your sugar with the glucometer once or twice a week. And I request everybody to see fasting sugar and before dinner also, not only after breakfast. Before dinner also, you should check so that either you don't go into hyperglycemia or hypoglycemia. If you don't have a glucometer, every 1 month, please go nearby laboratory and get done your fasting sugar and post-breakfast sugar. And if you have not got done your HbA1c for a long time, please get done your HbA1c, which will give us the correct figure how you are controlling your sugar. Now, in the food intake, when you are taking, if you can take more of protein, I tell everybody, don't add dal to the rice, add rice to the dal. That is, you take 1 cup or 1 bowl of dal and add 2 spoons of rice. Don't take 8 to 10 spoons of rice and add 1 or 2 spoons of dal. So if you take more of dal, if you are a vegetarian, your main source of protein is dal. So take more of dal. If you are a non-vegetarian, you can eat more of non-veg, but less of rice. If you are eating a chicken biryani or a mutton biryani, but the rice quantity should be less, where the mutton and chicken pieces should be more. That is very, very important. Don't eat rice more. Don't eat chapati more. If you can eat jawari roti, that is better than the normal our wheat chapati. So if you can avoid this gaon ki chapati, you can take jawari roti. That will also help in reducing the sugar. So these are few things which you will improve your diets. Now, other corona care everybody knows, but I still tell that while you are washing your hands, please first open or tap, wet your hands, then take the soap in your hand, and don't take soap first because then you will continue the water and the water tap will not close. Secondly, once you take soap first and then put the water, you will fastly wash away your soap. So you have to wash your hand for 20 seconds. Please count 20. Don't think that you have done correctly. 20 second time is important. The second important part, we usually wash our palm. We wash like this our palm. Here you have to wash your in between the fingers. You have to wash your knuckles. You have to wash your dorsum of the hand, and you have to wash completely. So this washing is important. Not just washing like this. This, I think you have a lot of photographs going on in WhatsApp and other social media. So please see that and wash your hands correctly. If you are in the house also, wash 3 to 4 times. And please, if you are in the house also, no doubt nobody is having corona, but try to keep a distance from your own family members at about at least 2 to 3 feet. And if a servant man is coming from outside, keep a distance from the servant man. If possible, avoid servant maid coming from outside. But if not possible, then keep a distance from your servant man and ask her to wear a mask and come. If not mask, there are many other like your handkerchief or any other thing. You can close to your cover your mouth and nose with that. And when that we are, whatever the material you're using, keep it outside the house. Don't bring that material inside the house. That's servant mat. And she should wash her hands correctly. If possible, if she has if you can put her some one or two dress material or her clothes, and if she has a bath and wear the new clothes and do the work in the house, then you can try to prevent the coronavirus. Now, one more thing is you should do salt water gargling twice a day. Take a steam inhalation twice a day, because diabetics are immunocompromised patient, and once they get corona, they are likely to get the severe form of it, and then it is a difficult. But everybody, all the diabetics may get, but may not get the severe form of corona. So if your sugars are under control, if your diet is good, if your physical activity is good, and if you are maintaining all the social distancing, washing the hands and other things, then you may not get the corona. So these are the few in nutshell how to prevent corona, how to control your sugar, and how to remain healthy. I still say stay home to stay healthy till the lockdown is removed. After the lockdown is removed, also for another 3 to 6 months, social distancing is very important. Please don't go to any public places being a diabetic after lockdown is over. Please don't roam about. Please try to minimize your out activities, outdoor activities, and try to maintain the social distance and washing the hands. Thank you very much for kind care.